Are you in the Ann Arbor, Michigan area and looking for ACL rehabilitation for your son or daughter? Then you've come to the right place at On Track Physiotherapy. You'll notice right away the difference at our facility where it actually looks like it's a place where athletes go as opposed to your grandmother's rehabilitation joint. And you're not only going to see the difference, but you're going to feel the difference as well too. And that's what I'm hoping to convey to you in today's short video, just our difference between our ACL rehabilitation process than some Joe Smo rehabilitation joint that your surgeon recommends you to go to, that he recommends everybody to go to. Our difference is we know athletes, we treat athletes. We've seen collegiate, pro, high school level athletes. I was an athlete level myself at the collegiate level. I say this all not to impress you, but to impress upon you our difference in the quality of rehabilitation we provide to people looking to get back to higher levels of activity and higher levels of performance. So this right here is an example of one of our athletes, soccer player, high school athlete, gave me permission to utilize his video, and he is 5 weeks post-op ACL. This is the start of his 5th week. What you'll see here is we do a lot of things that are very advanced for this stage, whereas most people who are doing rehabilitation at some random everyday physical therapy joint, they're just gonna be sitting on the table doing TheraPans, getting ice, and very low level treatment at this point in time. We have a specific process that we follow. In the start of that process for an ACL is making sure they get active knee extension restored through hyperextension, and we do that through what we consider this heel pop exercise. Keeping your knee on the table and getting the heel to pop up off the table should be your #1 priority immediately after surgery. This demonstrates that you have quad control returned and allows you a permission slip to start higher level exercises. If you can't do this, then we have to be more cautious with exercises. Most people mistakenly believe that getting their knee to bend is the #1 priority initially, and that, while it's important, is not what you should be focusing on initially, because I see people go on months and months without being able to get this heel pop up off the table. And that demonstrates that you have quad control. It demonstrates you have full knee extension, which is the #1 priority after an ACL surgery. And if you wonder 6 months down the road why you're still struggling to make progress with your strength, that's the reason why. It's because your rehabilitation professional did not emphasize that enough in your program. So there's a #1 difference. We get this done in a matter of weeks, whereas you go to other PT places, if you didn't know that, you go months without having this. And some people I see never actually restore this, which is a huge problem and one of the main reasons why there's so many re-injuries with this surgery. As I mentioned before, this athlete here is 5 weeks. He's not only doing it actively with just his body weight, he's doing it loaded with an ankle weight. Again, you'll see people 6 months after surgery not even be able to do this body weight. That is a problem. Secondarily, we work on knee range of motion. This isn't that advanced. We do things such as biking, rowing, gets the knee to bend, stretching. These are important things, but it doesn't take any advanced knowledge to get your knee to bend back further. So if that's all that your rehabilitation professional is providing you, you should probably be looking elsewhere. Next up in the session, we have some agility work. We're actually getting started with agility just 5 weeks post-op ACL. This is not dangerous because, again, he's hit the prerequisite of having quad control. He's established that, and he's demonstrated it with other exercises as well too that you'll see later on. Most people aren't able to start this until 8 weeks, 12 weeks post-op ACL. That is a problem. If you're trying to get back to high levels of performance, you need to start doing this ASAP, but you need the permission slip to do so. That's everything that happens prior to it, which is the quad control. Next up in the workout, we have a single leg pistol squat to a bench. This is, again, very advanced for 5 weeks because the athlete is not in pain, has full quad control. We've done things such as squatting already. We've done things such as squatting with load already. He's able to now handle a pistol squat to a bench, single leg under control. While most other PT joints are going to be focusing just on a leg press, sitting on a machine, doing things with very minimal weight, we're actually loading the quad and looking towards performance and balance coordination early on in the rehabilitation process. And you can further see that through the single leg deadlift here, shown with a barbell. Again, this is something that will be loaded up as time progresses through this process, as he's only 5 weeks right now, still gaining some of that balance and control back. But you can see the amount of single leg exercises we're doing that actually challenge people as opposed to just stand and do juggling activities on a balance ball, throwing balls at a rebounder, or sitting on a leg press machine. You'll also also see other exercises such as the star plank done right here, where we don't just focus on the knee, we focus on the whole entire body as a whole, because that's what athletes need. That's what athletes do. They move their whole entire body. We can't focus on just one aspect of the chain. We need to focus on everything. This is a high level plank that is done very hard for athletes who are not injured. But again, we're starting this 5 weeks post-op after a major surgery. Next up is some sled work. We do push pulling of the sled, and we load this up as well too. We do this starting day one with very little weight. Oftentimes we just start with the sled, but you can see here the athlete's moving well. We are starting to gain back power and explosiveness just 5 weeks after the surgery, and we even do a low bar sled push, which gets the athlete lower to the ground, which is essential for change of direction later on when we get to more advanced stages. Athletes have to be able to play low to get an advantage over their defenders. And then finally, to finish up, we have some isolation work of both the quad and the hamstring. We have specific numbers and metrics that we want athletes to be able to reach here. This is something he's going to be working on gradually and progressively through the whole entire process. But again, you can see just 5 weeks post-op ACL, we're actually utilizing some substantial load with him too, as the process does not need to be slowed down. You can get to high levels of activity, start feeling like you have a fitness and performance training session as opposed to rehabilitation as early as 3 to 5 weeks post-op ACL. So if you want your son or daughter to receive high-level ACL care that feels more like a performance training program to get them back to their sport in the safest, best way possible, then reach out to us. My email is greg@annarbor.physio. That is our website address as well, annarbor.physio. Google annarborphysiotherapy.com. We look forward to seeing you and helping you get back into your sport as safely as possible, but at a highest level of function possible as well too.